Patricia Coar, and I'm the Nutrition Manager at Burke Rehabilitation Hospital. Today I'd like to take a few moments to speak to you about bowel and bladder management in spinal cord injury. The first two key concepts I'd like to speak about are adequate fiber and adequate fluid. First, what is fiber? Dietary fiber is any plant food you can digest or absorb. It passes through your stomach, small intestine, and colon undigested. It may help improve the frequency of bowel movements. Fiber is found in vegetables, fruits, whole grains, beans, and nuts and seeds. Recommended fiber intake is initially about 15 grams per day. Gradually, we would like to increase up to 25 to 35 grams per day. However, you want to be sure to increase your fluid intake as you increase your fiber intake. And always caution with gas-forming vegetables, such as onions, cabbage, beans, and things like that. There are two types of fiber. We have soluble fiber and we have insoluble fiber. Soluble fiber absorbs water, it slows the transit time, and it relieves diarrhea. Insoluble fiber adds bulk, speeds the transit time, and relieves constipation. Sources of soluble fiber include rice, oats, barley, dried beans, and fruits and vegetables. Sources of insoluble fiber include whole grains, wheat bran, nuts, seeds, beans, and also some fruits and vegetables. Many foods, as I just mentioned, contain both soluble and insoluble fibers. Processed foods, such as canned fruit or vegetables, pulp-free juices, white pasta and grains, and any non-whole grain cereals are actually low in fiber. Processing removes the outer coat or the bran, which makes the food lower in fiber. To meet your daily fiber needs, you want to eat whole grain breads and cereals. Look for 100% whole wheat, rye, oats, bran, and make sure they're the first or second ingredient on the nutrient label list. Have brown or wild rice instead of white rice and potatoes. Enjoy a variety of grains. Good choices include those barleys, the oats, and the farro and quinoa. Choose fresh fruit and vegetables instead of juice. Check the label and choose products with at least 4 grams of dietary fiber per serving. Reading the food label is not quite as hard as you might think. Start with the serving size. Check your calories. You want to limit your total fat, cholesterol, and sodium, so look at those ingredients. Get enough calcium, iron, vitamin D, and increase the fiber intake and aim for 25 to 35 grams per day unless your physician tells you otherwise. A quick guide to understanding the percent daily value is if it's 5% or less, it's considered low in that specific nutrient. If the number is 20% or greater, the item is considered high in that specific nutrient. So look at fiber and look for 20% or greater. General healthy eating tips include choosing whole grain foods, fruits, vegetables, and low-fat dairy products. Lean proteins include meats, poultry, fish, eggs, legumes, nuts, and seeds, and choose healthy fats such as olive oil and avocado. Limit your saturated fats and trans fats, added sugars, refined grains, and sodium. The last item I'd like to speak about is including adequate fluid, because as you increase your fiber intake, you want to increase your fluid intake. Water is an essential nutrient. About 55 to 60% of our body is made of fluids. Once you noticed your thirst, you have already decreased about 2 to 5% of your total body water. Thirst is an early sign of dehydration. So enjoy adequate fluids throughout the day to prevent becoming dehydrated. Your fluid requirements are about 1 to 2 liters per day of liquid. That equates to about 6 to 8 cups of fluid per day. You can go as high as 12 cups each day, and that should ensure adequate fluid intake. So enjoy your meals, drink adequate fluids, and be well.